It could begin with something as simple as a cough or weight gain, but congestive heart failure is a serious chronic problem. There are steps people can take to try and control the problem. And joining us on today's Heart of the Matter with more on this important issue is Dr. Arie Szatkowski, a cardiologist with the Stern Cardiovascular Foundation. And Dr. Szatkowski, thanks for being here today.
Thank you for having me.
Let's talk about congestive heart failure. How is it classified? How is it diagnosed?
Well, congestive heart failure is a global term that describes a physiologic state in which the cardiac output, which is the amount of blood that's pumped out of the heart with every squeeze, is unable to provide the body with sufficient nutrition and blood. And it also can be seen in instances when the body requires high levels of nutrition or oxygen and the heart is just unable to meet those demands. As a cardiologist, when we classify this, there are multiple ways that we look at this. One way we look at it is whether it's acute, meaning the individual presents suddenly with symptoms and a diagnosis of congestive heart failure, or chronic. There's left-sided heart failure, in which there's predominantly failure of the left side of the heart, as the heart is separated into a left and right side, connected but separated into left and right side. Right-sided heart failure, or both. There's also systolic congestive heart failure and diastolic congestive heart failure. Systolic congestive heart failure pertains to the type of heart failure where the heart muscle is weak and unable to pump with sufficiency to push blood out of the heart. Diastolic heart failure, in a simple way, is when the heart is stiff and unable to relax. And we also classify heart failure based on symptoms. There's a New York Heart Association classification, and that ranges from 1 to 4, with 1 being absolutely no symptoms but having the presence of an abnormal heart, to 4 being bedbound in the hospital and on IV drips that are keeping your heart pumping.
Well, obviously this disease is an extremely important one. What is the impact of this disease on society?
It is currently costing the United States about $35 billion a year. It is the #1 hospitalization for individuals older than 65. About 5 million Americans suffer from this disease, and every year about 500,000 new patients will be diagnosed with heart failure. It affects the quality of life, and it has a tremendous impact on mortality, about a 10% death rate per year. What's very important about this disease is that as diabetes and obesity increases, the prevalence of this disease will increase. So, but even dwarfing those statistics are the fact that the population is aging, and heart failure is a disease that is most commonly seen the older we get. And as the baby boom population reaches into their 60s, 70s, we are already in an epidemic, but we're going to be facing an epidemic of tremendous proportion dealing with these patients.
Well, you've already mentioned some of the causes: obesity, smoking. Let's talk about them quickly, and what can one do to prevent this problem?
Sure. The #1 cause of heart failure is coronary artery disease. And as you mentioned, obesity, diabetes, smoking, all of those lead to the development of coronary artery disease. About 50 to 60% of patients with heart failure have this. There are genetic causes. They're idiopathic, meaning we're not sure what caused the heart to fail. Viruses, drugs such as cocaine, alcohol, heavy alcohol use, chemotherapeutic agents. And then there are other, hypertension is a very big cause of congestive heart failure. So if you target a large population, a large percentage of these patients are coronary artery disease, hypertension. These are causes that can be treated and possibly prevented early on. Prevention is the key. So educating people early on in life, developing good habits, can potentially lead to a reduction in the prevalence of heart failure over time. Heart failure is like cancer of the heart. And if you don't understand that, and if you don't follow the rules, you will die. It's critical that you follow the rules and really stick to the program.
Well, you've got my attention. Dr. Arie Szatkowski, thank you so very much. Joining us today on Heart of the Matter.